Good evening, everybody. Welcome to the Board of Health meeting for January 5th, 2021. Yay, 2021. I want to, again, I just want to remind everybody that during the meeting, we're going to ask that everybody remain muted unless you're called upon to speak. And I want to also let everybody know that this agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. Oh, can't make this stuff up with dogs barking either. All right, anybody here on the meeting for citizens participation?
Yeah, I might as well get it going and say Happy New Year to all and happy get rid of 2020. Have a good, positive, healthy 2021. For the town and everybody involved, we have a good, healthy and family style and get together with the Board of Health, and hopefully we can get everything good coming with Biden coming into the office. I myself is saying not very much. I said it before. It's good to know to have this town work together. And this house, my dad is on the list through the senior center, Meals on Wheels. We're on the list there. We get the meals, and I said it before, and I want to say it again because it is a great thing to have. That the town looks out for each other, and everybody that comes through is positive. So Happy New Year! It's positive, healthy, and that's going to be it for now. Thank you.
Thank you, Mark. Anybody else want to? No. Okay. All right. Hi, Jen. I was just looking, Jen. We did not list. I mean, I can obviously I can bring it up, but we did not list Mark's position under on the agenda. So I don't know if you want to hang on. I mean, I can just, I don't think we have much of an update for the board. I think, right?
Yeah, sure. I can totally. Yeah, I had thought I saw it on there, so I just want to make sure if you guys needed anything, I could provide it. But
no, I apologize, and that's probably on my error. So I will make sure.
It might have been the vacancy on the board.
Yeah,
I looked at it quickly.
And we are going to talk about that a little bit later on. But I guess we can probably just report that there isn't really much updates on that for the other. I just wanted to hold off for the update for COVID, Ed. I apologize. I skipped over. I just want to wait for Chris because he's coming on a little late. But Jen, do you have anything you want to say about the vacancy? I mean, we can kind of group them together here because it's kind of vague.
Sure. So we're in the process. I just wanted to give you guys a heads up because it's been a little bit of time since I came in front of you. So we have posted the position, and we have we scheduled a few interviews last week. We have another interview scheduled this week. We're reposting to make sure that it's sort of front and center on the Mass Municipal Association job page, so that we're hoping to sort of continue to get in applicants. So we'll work through that process. And then once we have the top two, we'll certainly do a second round interview. In the meantime, we've been able to utilize Steve Ward. So he is a former health director that has always covered for Mark if he had gone on an extended vacation or been out of state. And so he's been able to come in 1 to 2 days a week. And so while his commitment level has changed a bit at the turn of the new year, we still have access to him. So we certainly still have coverage for any housing code issues, any other Board of Health issues. Tom Curran continues to do food inspections. We have the Title V and septic being covered by Tom Ryder. So, and obviously Ed is doing all the COVID stuff. So, we're pretty covered. It's a lot of work on Laura and to some extent Diane in terms of coordinating all of the inspections and outreach. But I did want to let everybody know that is, we're still working towards that. And we're not quite ready yet to bring the top 2 applicants to the committee for the second round interviews.
I mean, Jen, if you have a minute just to talk about also, I don't know if you'll have any input on it, but we can get into the Board of Health position vacancy. That the charter, I know KG sent me the charter. I believe Laura sent it to everybody anyhow. So it talks about that the select board and the Board of Health can do a joint appointment I reviewed with Michael, not council, but I reviewed with Michael that in the past, I believe the planning board and the select board chose not to fill a vacancy, because normally what we ask people to do who are interested in running for the board or running for a position is to attend multiple meetings, make sure, obviously it's a good fit for everybody, as well as to make sure that they can fit the schedule, on a Tuesday night meeting and so forth. So I wanted to bring it to the board's attention tonight. The select board is going to talk about it tomorrow night. I plan on attending the meeting and letting them know what our board collectively has decided to do. Looking at the time frame myself, of course, with Judy resigning from her position, that automatically will be, obviously this position will automatically be on the election in May. So I personally, I'll go around, we can talk about, I personally don't see that we've had any split votes that we would need to fill a position immediately. I think we could ask people, I think even Barbara, I know, has been on our meeting, ask people who are interested in being involved in the Board of Health, maybe to attend a few meetings. And hopefully they, like what we do and want to participate, and hopefully therefore they would run for election.
Diane, I think the charter requires us to fill in unless it is within 100 days. That's when the election can take. Otherwise, we have to fill it in. That's what it says. And also, I'm not sure what was the date that Judy Teller signed the real signature paper, and that was submitted to secretary, the clerk of the town. That's where it determines the start date of counting the number of days required for it. I mean, we may be running out of the clock, and then the selectmen may have to fill that vacancy in about 10 days or something. So I'm not sure, but it depends on what the dates are. So you probably you probably have more of the information than I have. So
Judy's position was effective December 1st. So of course the election does not fall within the 100 days of the charter.
Right.
I don't know. I did not, I have not talked to any of the select board members or council for that matter. And Jen, I don't know if you have recollection of it. But I know that there was 2 positions in the past that were not filled. And I'm assuming I'm just going based on my common knowledge, I'm assuming it's for that reason. There wasn't commonly a split vote that they needed that 5th person. But that's my assumption.
Do you know whether she tendered with wet signature a paper to the clerk already on that day?
Yep.
Oh, okay. So that's when the clock
starts. And then they followed the proper protocol to notify the select board as well. So that, that time frame has been covered. So are you feeling that you want to?
I think so. I think so. We should always fill it.
Okay, so do you think it would be appropriate to have whomever may be interested in filling the vacant position attend a couple of meetings before we take any action before the select board?
We have nothing to check on it other than their whatever they gave it to the town, their talent bank paperwork. That's the only thing that is required.
Correct.
So if they attend or not, they might have been watching the meeting, attending it, but they have not been actively participating. We never noticed that. So.
Right. Well, that's why, I mean, obviously we have to, take a vote from the board to obviously move forward with that. So, I'll go through the board members and ask them what their intention is. So, Ron, do you have a thought on this?
I mean, I do. I get what KG is saying. So basically, you're just really looking at a resume. But when I initially, before Kitty Mahoney got the position, I actually spoke with Steve Mitchell. Yeah, he just wanted to get a feel, and he just did. It was just like a 5 minutes to get to know you kind of thing. Not, what do you know about the Board of Health? Just, to kind of get a feel for you, and so they could pick somebody who was appropriate. And as soon as they told me Kitty Mahoney, who had more experience, I said, you should definitely pick her. So I think even if it's just you, Diane, because it doesn't have to be all of us talking to her. You're the head of the board. I personally trust your judgment. I would, tell you, they don't have to talk with each one of us unless people specifically want to. That's my only thought.
I mean, the charter only tells that requirement of each one being spoken for the Board of Health director. That's where it says that each member needs to talk to them. That's what it says, but nowhere else it specifies that the fellow board member be talking to any others. But if they want to, that's fine, because they want to know how things are run and what is the problems, what are the issues, and they want to know about it. The candidate, whoever wants to be part of it, I'm sure they can probably reach out to any one of us or all of us or the whole board if they want to. That's it. I don't see any other way that I don't think you ever spoke to the Board of Health, Ron, when you came in. It was
No.
only Steve Mitchell, because he was interested in knowing who you are and what you're doing. That's why probably he reached out to you, I guess. Is that right?
Well,
Yeah, he did, but he had told me that he had spoken to the other potential candidates.
Right.
As well.
Right. That, as an individual selectman, he did it. Right.
Well, I would, just to jump in before we go to you, Chris, sorry, I just want to say is that I would expect that if there's I'll say a candidate that is interested, fill us at a talent bank form, maybe attends a couple of our meetings, that we would all respectfully maybe reach out to them, or multiple, I mean, hopefully we have multiple people, but because they need the education from us as well. So it's not, so to speak, just interviewing them. I mean, it's finding out, what their background is, or what their intentions are, or do they plan on running for election in May? So I mean, a healthy conversations, obviously, individually, not collectively. But with that, Chris, do you want to chime in? I assume
Yeah. First, let me apologize to everyone because I was zoned out on the days of the week and forgot what day it was. So I apologize for being late. But just, I'm assuming you're talking about filling the vacant position. Before I was elected, I was appointed to fill a vacancy as well. And I don't know what went on behind the scenes before then, but I know that the process I followed was to fill out a talent bank application. And then I was asked to join it was a joint meeting with the Board of Health and the, so at the time, Board of Selectmen. And they asked me to make a statement, and they asked questions. And so it was kind of like an informal interview type of thing. So I thought that was a pretty good process.
Okay.
But, if there was a process before that where the talent bank applications were shared between the Board of Health and the Select Board, I think that's probably a good idea too. Just in particular, if, let's say, 20 talent bank applications come in, we don't want to meet with 20 people. We probably want to review the applications and maybe pull out the top 3.
Yeah, you have no say on that. To who we call and who we do that, I think it's voted upon on the joint meeting. That's the only thing is, even if there are 20 people, they may have to come up, and then if the Board of Selectmen make a decision not to even ask them to come and make a statement, they can just say, look, we have 20 people, here are the names. They could do that. They govern the meeting agenda mostly.
Okay.
And to my knowledge, for the past 6 or 7 years that I've been here, this is the things that I have followed all the time.
Well, I think in general, I think the consensus is to put it out there that we're looking to fill the vacant position until May, and see how we do for talent bank forms.
Sure.
And then what I'll do is I will go on to the meeting tomorrow night for the Select Board and let them know that's the board's intention, and we'll see how many we get, and then we will obviously we'll get them to the board, and then we will set up, we'll probably meet, I don't know how long it's going to take, but hopefully we'll get a few, and then we'll we can set a joint meeting, and then we would go in front of the Select Board and then collectively vote on a new member to fill the vacancy.
Right.
Is that okay with everybody?
Yeah, thank you. That's good. And then I'm sure they usually share these talent bank forms with both Select Board members as well as the Board of Health members.
Yep, as they come in, you'll receive them.
Yeah, we usually have an advance information of it, so that should be.
All right, great. I will do that tomorrow night. I will let the Select Board know.
Sure. Thank you.
All right. I'm gonna, Jenna, obviously you're welcome to hang on the meeting. I am gonna go back to the COVID-19 and have Sergeant Berman give us some updates.
Hi, everyone. The first thing I want to do is I want to introduce everybody to ACUTI. You know, if you know, a couple of months ago, we were talking, or even a month ago, we were talking about seeing if we could leverage and work with some of our colleges for an intern to help us with contact tracing. Also, you know, for a couple of reasons, you know, number one, we don't have to pay because we don't have the money for that, and which is always nice. But ACUTI is an Ashland High School graduate, and she's at Worcester State University with a major in public health. So she started working with me about a week and a half ago, and we're getting her up to speed on contact tracing. We did a COVID inspection and just kind of showing things around. She'll be in town hall a couple of days a week. So I just wanted to introduce everybody first to her.
Hi.
Thank you for your
Welcome.
services. We appreciate it.
Yep. Thank you.
Yeah. We've got a lot going on, especially because of the holidays, everyone. So the first thing I do want to report is that Walgreens today was at Waterview Lodge doing the first vaccine for all the staff and employee, I'm sorry, the employees and the patients at Waterview Lodge. I actually took a ride over there to see how it was going, met with Dutch, very organized. I was actually pretty impressed how they were ready to go. Walgreens sent over 5 vaccinators to do everybody. So today is everyone's first dose, and they will be getting their second dose. I believe he said it was January 20th. Mill Pond Rest Home is scheduled with CVS for January 27th. And I have not found out from residents of Valley Farm what their date is yet. So most of you probably know the long-term care facilities had to contract with one of either CVS or Walgreens for the vaccine. And that is going pretty smoothly from what I can see so far. Mm-hmm. Most of you know the high school is in all remote right now. That was due to, we had a little bit of a community spread amongst a bunch of students. Mr. Adams made the decision to put the high school in remote, which will be in remote this entire week. And we're going to reevaluate it Friday morning at 7:30 at the school committee meeting. This was, again, because of vacation, it was not spread in the schools. The other schools are open. I also want to report, as of today, internally, we have tested with our machine 237 people since we got it, town employees. It's been very beneficial, especially when we need to get people back to work, different things like that. Our numbers are creeping up, obviously due to the holidays, but we have a pretty good handle on it. The school nurses, I have to give them the big shout out, everyone, and maybe someday the board, I think we need to recognize the school nurses for all the work they're doing in the background, especially when we have a case and it involves a student or a family with kids in the district. I'm in daily communication with them, and especially Audrey. PPE supplies, we have right now, we're fully stocked. Police and fire are scheduled for their vaccines next week. We don't have the actual date yet. DPH sent out a guideline for municipalities. We did not meet the initial criteria of having 200 first responders. So what I was able to do was I partnered with Sherburne. So it's a 5-town partnership that we formed: Sherburne, Ashland, Hopkinton, Westboro, and Northborough. The Westboro Board of Health Director did the paperwork for DPH. We got approved. So what'll happen is the vaccine will be delivered to Westboro, and the Westboro Fire Chief has already secured the currently closed Doubletree Hotel, which will be the vaccine site for our police and fire and dispatchers. I'm trying to get the school nurses included in that. Hopefully we'll be able to do that. But that is tentatively scheduled for Monday, Tuesday next week. We're just waiting for the final confirmation from DPH. And I guess I'll open it up to questions from there.
And one question I had is I know you had a conference call yesterday about it. How's it going to happen with the senior population, or just rolling it out to the general public? Do we know yet?
We don't know yet. And that's the big, we keep questioning that and asking those questions, and we just don't have those answers yet.
Because I know in a meeting that we had internally that you said that the state is contracted with CVS and Walgreens for vaccination. For
the long-term care facilities, yep. They have not told us, I mean, we're ready to go. I mean, we've got our drive-through site set up. I mean, obviously we will need people to help. The one thing I think that the state, we're trying to find out is, for example, if we have volunteers, nurses, that are willing to help with these vaccine clinics, is the state going to pay them? I mean, yes, some people might volunteer, but, those are the questions we have. And again, like I see Barbara's here, I'd love to bring Barbara on, but we don't know if the CARES money's being renewed yet. What's going on with that and how much that's going to be. It's all these unanswered questions.
But do we know how many are there in that population group that we need to care for, and then how good number of staff that we need to cater them?
So KG, when we met with the state, Mark and I met with the state, probably a good 2 months ago now. They're supposed to be, we gave them our, all the statistics in town, and they're supposed to project that, how many they would anticipate us having to vaccinate. And again, we've just not received any guidance from there.
So that won't be again going to CVS or Walgreens, one of these, but we may have to take that step. Is that right?
Yeah, my gut feeling is, KG, that they're going to probably want to do it similar to how they do flu vaccine. It will be available at, Walgreens, CVS, doctor's offices. And then I believe, hopefully they're going to ask the local boards of health to be involved, just like we are with the flu clinics.
Okay, all of these is Pfizer or Moderna vaccines?
So right now you don't really know what you're getting. I did get vaccinated last week because of the hospital. I got the Pfizer vaccine. I do know we've already been told for police and fire next week, it will be the Moderna. And I do know at Waterview Lodge, they got Pfizer.
Okay. They don't have an option of choosing their one?
No.
Okay.
Any other questions?
Ed, could I ask a question? Sorry, I was just going to ask you if the MRC is going to be involved at all, like any of the MRC members? Yeah,
if we're going to have a clinic, we'll absolutely need them. Yeah, it'll be all hands on deck.
Trying to get the first responders and the, the nursing home staffs on first. But. All right, well, thank you for all your hard work, Ed. We appreciate it.
Thank you. Good job.
All right, let's move on to the IMA with the city of Framingham. To begin with, I did not see the article, but from what I understand, there was an article about Sam Wan from Framingham retiring, whatever the situation is. I hear it was a great article. Unfortunately, I didn't see it. I haven't heard that it does affect our agreement at all, which is good. But with that said, I reached out to town council again. We're just waiting for her review before it goes to the select board. I think with the holidays, things kind of got tied up. So don't really have too much of an update on it, except for we're just waiting for town council to review. And then, maybe even a couple meetings from now, we'll get in front of the select board and get that approved by them so we can move forward with that. Anybody have any questions on that? All right, moving right along. Future tobacco compliance check. KG had reached out to me, which I thought was a great idea because of our, this is where I thought you would be excited, Amy, being funny, is that unfortunately our last round of compliance checks were less than adequate to all of us. And so KG brought up a bit more so, as I mentioned, that we should do a compliance check sooner than later. Of course, we don't have to let the public know, but I think it's a great idea, and hopefully our results this time will be more favorable on the
right. I think because of this COVID situation, everybody's staying at home, and more of these things are increasing. The more people tend to consume tobacco, and then people who are not supposed to consume, they also consume it, or they also get the access to it. And that's also probably hurting the substance abuse also. I think that's when we recently got a directive from the governor for handling the substance abuse people. Now, I think it was sent out today or yesterday. I'm not sure, but Laura gave it to us. So
Yeah, and as we talked about too, in that last round too, I think that we have to take a little action to do a good job, a better job of communicating to the people, to the citizens of Ashland, that if they're going into the places that we license to sell those products, that they are going to be expected to show an ID.
Right.
And if they don't have an ID, they will not get a product.
You said it right.
And
Yeah.
with that said, I know that we, I believe it was the local pages, but looking for articles for their February edition, but that might be something that we could write something up just to put a nice note in there.
Mm-hmm.
So I will,
And I did reach out to Ed about getting some information about substance abuse in the town data. So he said he will probably get that thing out for us sometime soon. So it's better to keep an eye on that aspect also.
well, I am working with Melissa, our tobacco agent, on just getting her badged and business cards and a couple of things. So I will talk to her and we will coordinate another round of compliance checks.
Sure.
So thank you for bringing that up, KJ.
You're welcome. And then I'm glad that it's worked on. That's good. Thank you.
Yep. All right, moving right along to cell tower discussion. So this was something that I wanted to bring forward to the board. I know that we have received multiple communications from a couple of residents about concerns about cell towers. And I'll say 5G, Wi-Fi. I mean, it's definitely not my wheelhouse, so to speak. I'm learning, trust me, every day I talk to CC, or I should say, the last time I talked to CC, there was a very lengthy conversation, and I appreciate all of her knowledge and all of her passion, but it was so overwhelming. So basically, just so the board knows, I told her I would bring it to the board's attention, that we had a lengthy conversation, and we as a board cannot regulate cell tower installation. But what she was hoping that we would do would be to come up with a group, which of course I suggested she lead the charge, to educate the public on how to use devices. I guess I'll just leave it at that. Like I said, it's not really my expertise. I told her that I would let the board know that we spoke, just to kind of circle the loop. I don't know if we have more interest than the couple of people who have reached out to us to set up a committee. What I'm a little bit leery about, and that's why you can probably tell I'm a little hesitant, is that I literally, the last time I talked to Cece, it was a 45-minute conversation, and there was a lot that she gave me, which was great information. And my big question was, how come all this great information that you're giving me now, you've given to the state, the federal government, other states, whatever, and it goes nowhere?
I think Senator Spilka had created a committee or a commission or something that was studying all these things, and it may be worthwhile for them to keep us posted on what's happening there rather than.
So I can tell you that committee is no longer anymore because it's not in the Senate president. This is all from CC. I'm just relaying is that it's not something that the Senate president can move forward with. That's not in her current position to do that.
Okay.
CC explained to me that the information was given to at the state level, multiple different agencies at the state level. They had said that they wanted to come up with like a flyer, if you will, to educate people. She prepared it, she sent it to them, everything was great. And then what they decided to do is publish something different. And again, I asked, of course, my question was, well, why? Like, what, did they not believe the information? Did they not like the formatting? So it just seems like there's so many different levels on it that my opinion is I don't think it's something that I want to take on as a Board of Health, because if the federal government is dealing with it, but the state is not dealing with it, I don't think it should fall down.
Oh,
to the Board of Health.
Yeah, at this stage, maybe we can suggest CC to reach out to the MHAB because they usually take up these major issues on a larger field to talk to all other boards and get things done. Or that may be a place where she has to put in
Right.
her effort. Maybe she could reach to
What she was gonna
Mike
do is
Hugo
continue-
or somebody else, or Shel Sabaro, one of those members, to get attention there.
What she was going to do is continue to work with, I believe it was the Department of Public Health. But I mean, it's a good suggestion. I can let her know that she might want to.
That's another board which takes more active role in it if there is anything there, and that may be another arm for her to fight on for
Yep,
with their tools. So
sounds good. I'll be glad to pass on that information.
thank you.
All right, moving along, Ron, the Housing Production Plan Steering Committee update.
So I wrote a few things down. I don't want to get too in depth. This is I'm sure Jen, who's been pretty much on all the meetings, can just correct me if I'm wrong. This is all very new to me, but basically this the Housing Plan Steering Committee is hopefully Ashland's way of trying to create a proactive strategy to comply with state statute chapter 40B. And basically what that chapter 40B is it's hopefully our way to include affordable housing by the standards of the statute, which you can read. But basically it says that the most important number is for most people, even though it doesn't unfortunately work out that way, is that a total of 30% of your net income should go toward housing, so that the rest of your income can be for food, cars, clothing, insurance, and those type things. So there's different ways to meet, those standards to be included in it. And I'm sure Jen knows, and I'm sure that, Peter Matchek and Emma Snellings, who are the town planner and assistant town planner, they head up this housing production plan steering committee. They know the criteria. It was a lot different than I thought. I thought it would be just an income-based thing, but you can make potentially as a household make over $100,000 and still have a portion of your housing costs subsidized, by these things. But specific Housing Plan Steering Committee, that also follows, some basically bylaws to meeting. We meet apparently every 5 years to review the plans and try to comply with, the statute 40B, which basically says that 10% of a community's housing needs to be available to low and moderate income families. And Jen, please correct me if I'm wrong, but I think that if we don't meet this 10%, then it's possible for a developer to override local zoning bylaws without the consent of the town and kind of do what they want to do. Is that kind of correct? So it's a way for us to not only plan for it, but for us to still be in control of the housing and, all housing, not just affordable.
Yeah, that's correct. So you could have a developer come in and do a 40B project. And so it supersedes your zoning and they get what's called a comprehensive permit. It does go through the zoning board of appeals, but it supersedes our local zoning laws. And also a lot of some of the permitting that happens at the board level.
Right. Okay. And so apparently from the 2015 housing production plan meeting, and basically one of the most important points was to try to adopt a town-wide inclusionary zoning bylaw. And so what that inclusionary zoning bylaw means is that it's going to require a percent of the new units in housing developments to be affordable for income eligible households. And there's criteria that I'm sure Jen could explain to you much more than I can what those meet. And we want to, or it's supposed to rely on private developers to create affordable housing without any public subsidy, at least by, by our town specifically. And where it tries to balance the elements of the policy to minimize costs. Otherwise, there's a risk of increasing rents or dampening development. And I don't know, Jen, do you want to expand on any of that at all?
Yeah, sure, I can. So with the plan, there's many different strategies that a town can take to try to reach the 10%. So it is definitely something many suburbs struggle with. I don't have the percentage of where we are right now. It is recalculated every 10 years. And so, as your housing stock goes up, the number will fluctuate based on the number of units that would count for affordable housing. And so hopefully with the steering committee, what we'll have is sort of a pathway forward that we can move forward to try to reach our 10%. Again, I think for the reasons that Ron nicely laid out in terms of, it certainly provides affordable housing for our residents, but it also protects us from a 40B development in a place that wouldn't necessarily work for us as a community. And so that's sort of the purpose of the plan. And I'm hoping that the steering committee, they'll have some good strategies that we can work over the next 4 or 5 years to really implement and make some progress on.
Right. So, just briefly, what a housing production plan element includes is a comprehensive housing needs assessment. So there's many things it relies on: available census data, demographics, housing stock, school enrollment, household income, types of housing that we have, housing affordability. So there's a lot of different things. So that's one. Affordable housing goals, meaning the types of housing consistent with the community and regional needs, and a few other things. And then implementation strategies such as zoning or identifying sites, that we think would be best for this, and then allocating resources. Then after the plan's formulated, I don't know exactly, does it get approved, Jen, by the select board and the planning board? And then it gets, if it's approved by them, then it gets submitted to the state for approval? Is that how it works? Okay. And there's just one little thing about housing affordability, which I thought was interesting, that, the people might want to know. These are 2017 stats. But it basically says that we have 410 out of 6,581 housing units in Ashland that are subsidized. And that's going to change after, the incoming developments and the 2020 census is tabulated. So currently 6.23% of our affordable housing needs are met. We want to get to 10%. And that's up, though, from 3.66% 5 years ago. So that's, we've almost doubled that, which is really good. Apparently, right now, the number is there are 1,885 income eligible households in Ashland, and there are currently 410 units on the subsidized housing inventory. And the interesting thing is, this is sad, but it's where it is right now. And hopefully we can improve upon this. For every 5 income eligible households, there is 1 unit on the town's subsidized housing inventory. So it's basically telling us that we're 80% short for right now. So that's pretty much it.
And just one other quick point is that the other benefit of having this housing production plan, and if we start to make progress towards reaching the 10%, so they obviously don't expect us to go from 6%, which we've been, building up over the last number of years, to immediately go to 10% for sort of that safe harbor. As you make progress year to year, there is a way, if you build up, 1%, you're able to get some safe harbor from 40B. So there is some incentive to sort of make incremental increases in that percentage. So, but you need to have an approved housing production plan for you to be able to do that as a town. So that's why another reason why going through this process is not, is really beneficial for the town to not just have a roadmap forward, but also to provide us some sort of milestones as we move through to try to reach that 10%.
I have to
Thanks,
say
Jen.
that, just working for the town for a long time, I've found this information throughout the years very interesting. It's
Yeah.
very eye-opening. So
Yeah, it
thank you for the
really is.
report.
Yeah, no.
Yep. I'm just going to jump ahead, Ron. Just are you meeting quarterly? I mean, is this something we should keep on monthly for the meeting?
Well, it's not necessarily specifically. We've had
Okay.
2 or 3 meetings, and then there was one public forum. That's actually not that anybody really wants to sit through it, but it's actually on the website. It's about an hour and 20 minutes. Kind of interesting. There's a lot of demographic information and data there, about comparing us to other towns and us within our town. There's another public forum that's scheduled or not scheduled. It's tentatively supposed to be in sometime in January, but a date hasn't been figured where, people got on. Last time, I think there might've been 25 people, Jen, you think?
That's great.
And if they have a very interactive way, they can put a question up and everybody signs in and you can, voice your opinion. And, some people would think things were very important to do and other people would think it's not important at all. So the town, basically people can be involved if they want to be.
Well, what I could do is I can leave it on as an agenda item for you to give an update and maybe plug the next public forum then.
Sure.
Awesome. Thanks, Ron.
Yeah, thank you.
Another thing you'll see the next item on the agenda, I don't know who follows the select board's agendas, but they have a consent agenda on their agenda, and I've had this thought for a while. So I'm going to start putting stuff under the consent agenda, basically for the board to know about the information, receive the information, but we don't necessarily have to discuss the information. For example, the budget, we kind of all just usually look at it and say, yes, everybody's looked at it and kind of move on. Jen, just because I can't remember, does your board vote on the consent? They don't vote. They don't have to. Oh, we lost Jen. I think it just has to be on there because there's no discussion. But anyhow, so if there's any items like that, like even if there's a public forum that you want to put on there or a meeting or something you want to plug for the public, we can put it on there just as a notification, but we don't need to specifically discuss it. So with that said, I'm going to keep moving along from the consent agenda. I apologize. I know you've probably been looking at the side of my face for a little bit. I was making some list of items for the next agenda. I'm assuming we all probably got an invitation for the next decisions at every turn meeting. And I know, Ron, you and I had been going. I signed up to attend. I just, as long as it's just 2 of us, then actually now since there's 4 of us, we wouldn't be able to do 2. Well, if we don't have an open discussion, we can attend together, like as long as we don't talk about what the board's doing or
Right.
But if you're interested in attending that,
Diane, would it have to be over 50%, so 2 out of 4 would be okay?
no, it's a majority, but I don't think, like when we've attended the meetings before, we don't have much, and we've discussed their items, but not our own. So I think we're covered no matter what. But I'll just confirm it just to make sure. But I did sign up to go, so I don't know if anybody else is interested in going to that next week. But I think the housing production plan I put on to the next meeting, health director / agent position, and I apologize, it was kind of grouped together. The DAET meeting, the Board of Health position vacancy, and I can't get into details now, but we might have first, since I've worked for the town, but we might have to address a hoarding case at a public meeting at the next meeting. So we'll see. Hopefully that gets addressed without having to have a board discussion about it. So I'll let everybody know.
Sorry about that, Diane. I pressed, instead of unmuting myself, I pressed leave. Yes.
Don't worry, the select board doesn't vote on the consent. They just move.
Yeah, you do. Okay. Yeah, so you just vote. You just vote as presented. So
they
you can just, yeah. But if it's something that you wouldn't necessarily, like if it's just for informational, you may be able to just say for informational purposes.
Right, because I'm not looking for them to appoint anybody or anything like that. That's what I thought. I did move on. I said,
Yeah, sorry. I just,
No, that's okay. Yeah, but if there was an appointment of like the animal inspector or something like that. we
yeah,
could-
so you would just move to approve as presented and
Okay.
then,
All right. All right. Anybody else? Just the next Board of Health meeting is January 19th. Anybody else have anything for discussion besides the list that I did?
Unless there's a joint board meeting with the Board of Selectmen, isn't it?
Right,
That's right.
yeah.
Nothing at present. If there is anything else, we'll always buzz you and then let you know.
Thank you, KG. All right, does anybody have anything else for the meeting?
Except I get the pleasure of making a motion to adjourn the meeting.
Thank you, KG. Do I
I'll
get a
second
second?
that. I'll
Thank
second.
you, Chris.
Right.
All in favor?
Aye, KG.
Hi,
Hi,
Chris.
Diane. All right, good night, everybody. Good to see you,
night.
See you
ladies.
next week,
Bye-bye,
Amy.
Jen.
Yep, bye-bye.
Take care.
Bye, everybody. Thanks, Ed.